Dr. Ukpaka, your host on the Health Corner Show. Today, we're going to talk about hay fever. I know so many people are wondering, what is this hay fever? I've had questions. I've had people asking me, please, what is hay fever? Is it a disease? Can it be cured? I want to use this program today to address your questions. So, what is hay fever? Before I answer that question, I will tell you, I'll discuss a little bit about pollen. Pollen is a fine powder from plants, which is flying in the air all the time. But it's worse during the hot periods, like summer in Europe. But it could be all year round, depending on the trees around. It's also carried by grasses. So you find out that when you cut grass, there are things you might release into the air, and these pollen are not visible to the ordinary eye. So, but you can breathe that in, and you find out that some people tend to have allergic reaction to this pollen. These are tiny things, tiny chemicals that are produced by plants. They are everywhere, so they are natural. This is the reason why those people who react to pollen are said to have hay fever. Hay is, hay is a plant, found in a farm, and then you've got the fever, and so the name hay fever is actually a type of allergic reaction to pollen, and it's very common. I can tell you that some people who have allergy to pollen also react to things like dust and other chemicals in the air. So it's an allergic reaction. Like I said, it's worse during certain seasons, the hot seasons, when the plants are producing flowers, they release a lot of pollen. So if you're watching the weather, they'll say, oh, the pollen tail is high today because it's hot. So this is to warn people who suffer from hay fever to be careful. And hay fever can actually run in families. It tends to start from childhood in some people, and it's more common among boys than girls. But in adult population, men and women are equally affected. So you can find out that this is a fact about hay fever. So remember what I said, it's more common among boys than girls, but between men and women, it's actually equally distributed. So it's 50-50. So some people with hay fever might have other allergic conditions like eczema and asthma. But remember, even though it's called hay fever, the person does not have a temperature. So do not confuse other causes of fever with hay fever. If you have hay fever, I would very soon we'll talk about the symptoms. There is no temperature. I keep answering these questions from people who say, oh, I have a fever. It might be hay fever. It is not. Now, what are the symptoms of hay fever? People who suffer from hay fever will come to you, they're always having blocked nose or runny nose. Their nose is runny because of the release of what we call a chemical called histamine. So that causes the nose or the mucous membrane to produce a lot of mucus, and they have a runny nose. Histamine also causes itchiness, red and watery eyes. People with hay fever will also be coughing a lot and sneezing. Some people will have itchy throat. The nose, ears, throat, and eyes are connected in some way. So you can see some people can have itchy throat, itchy nose, itchy ears, itchy mouth. And then there are people who say, oh, they have the loss of sense of smell or sense of taste. They can't taste anything, because of hay fever. These are all possible. So other people can complain about pain in the temples or forehead. They can have headaches. They can have pain in the ears. They can feel very tired because they don't sleep at night due to the blocked nose. They can't breathe very properly. But remember, there are other conditions that cause blocked nose, earaches. If your child or you have a fever, please don't say you have a hay fever. You have to seek medical help. Now, a group of people may have fever or an infection, which is the commonest cause of fever. And then, they might not have fever. So these are the people who are taking immune suppressing drugs. We have to be careful among those. If you are someone on steroids, on HIV medications, on certain chemotherapy, please always see your doctor if you have any of these symptoms. Itchy nose, itchy eyes. Don't say you probably have hay fever. Seek professional help immediately. I'm talking of the immune suppressed people. Now, this picture shows what happens to people suffering from hay fever. I talked about pollen. We breathe in the pollen into the nose. It gets deposited on the lining of the nose. And what does it cause? Allergic reaction. Once it touches the mucous membrane, then the body produces histamine, and that histamine goes under the mucous membrane or the skin and then causes the itching and production of a lot of mucus or fluids. And this is the reason why it becomes, runny nose, or the mucus can just plug a hole in the nose and your nose is constantly blocked. If it is the skin, the person might be sweating a lot, it will be itchy, you might observe some form of rash, but that is allergy, not necessarily hay fever, because remember I said there are other causes of allergy and not just pollen. So, some chemicals, some drugs, if you're allergic to things like penicillin and accidentally take that, the person might react violently. So you just be careful when you're talking about hay fever and allergies. Always seek professional help if there's anything that you don't understand. If you look at the eyes on that picture, the eyes is red, the eyes are red and watery. If you look at the nose, the person will be congested, sneezing, and runny. You can see the throat. It's itchy. People talk about sore throat, not necessarily postnasal drip. Nasal drip is when you have mucus dripping at the back of the throat when you lie on your back. So that can also happen with hay fever, but there are other conditions like polyps that cause that. Then cough is due to the irritation. The person wants to get rid of the mucus, and then he's coughing all the time. So, this is just a diagram to show what happens when someone has hay fever. If you look into the covering of the nose, it will be red, it looks inflamed, but it will not be pus because you don't have pus in hay fever, So these are some of the signs and symptoms of hay fever. I'm going to talk about what we should do, one, to prevent hay fever, and the treatment after a short break.
Health Corner on BENTV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome back. Yes, we're still on hay fever. We've talked about the different causes of hay fever. What is it that causes hay fever? Which is pollen. I described what pollen is and what are the signs and the symptoms of hay fever. Like I said, if you have temperature or fever, it is unlikely you have hay fever. You need to seek professional help. Now, in this segment of the program, I'm going to talk about, what do we do to prevent hay fever? Because I know so many viewers are very interested in this aspect, in this part of the discussion. So hay fever is the commonest cause of achoo. You can see the picture of someone saying achoo. So that means that the person is sneezing a lot. Now, some of the things we advise people suffering from hay fever is, if you know what causes hay fever and try to avoid it, then you minimize the exposure to hay fever. So what do I mean? Now, we'll say we have the do's and the avoid, or do's and don'ts. Now, if you know you have hay fever, or you have the risk, you've suffered hay fever or you have a bad one, always try to wear what we call wraparound sunglasses. I remember I talked about pollen. If it comes in contact with any part of the body, it could be the nose, it could be the eyes, the mouth, it causes itchiness, runny nose, or itching, or the discomfort or pain. These are all signs of allergy. So if you're able to protect your eyes by wearing the wraparound sunglasses, so that the pollen or whatever you might be reacting to doesn't creep into your eyes and cause the watery eyes, that is a good way to a good step. Remember, if you go to cut grass, when you come back home, try and wash yourself, wash your clothes, because you're likely to have pollen. And when you bring that into the house, it doesn't help, does it? So you find out that if you don't wash yourself, you have the pollen distributed in your room, and you'll be sneezing a lot. So something in the house, is very important. Also, I'll talk about this in more details. Look around your house. Some people have things growing on their walls. Some of them produce some chemicals that people react to. So, but that's for another day. I'm going to talk about that, more about that. Now, if you are indoors, and when possible, stay indoors. Obviously, if you have to go out, because you go out. But if you don't have to go out to expose yourself to pollen, you try and spend more time indoors. Now, keep your windows and doors shut, especially for people who have bad hay fever, because the pollen, comes from outside and enters into your house. I know if the house is very hot, especially in summer, you want to get some fresh air, but actually in getting the fresh air, you pay the price of getting pollen into your house. It could be in the day or it could be at night. So, just be aware of that. Now, vacuum regularly. I talked about people bringing in pollen. Visitors coming into your house might even bring this pollen into, sit on your seat, deposit some of them on the floor or on the chairs. So always vacuum and dust your house regularly. So it's about being hygienic, and cleaning, keeping yourself and your environment clean. Now, we've talked that some people mention getting a pollen filter, through the air vent, in your car, or vacuum cleaner. But that's you can try that, but it might be a bit expensive. Now, what are the things you should not do is expose yourself to grasses. Obviously, we'll talk about that. Spending too much time outside. Smoking cigarettes, exposing yourself to smoke. Even though you don't get pollen, but there are so many chemicals that can cause allergies from just cigarette smoke. So, you remember that if you are allergic to one thing, you might be allergic to many others you don't know. So, but for hay fever in particular, we'll talk about pollen, but there are other causes too. So, avoid pets in your house, especially when they go outside, bring in these pollens from grasses and come into your house. So, if it's possible, if you have a pet, keep your pet clean. We're not saying you shouldn't have pets. But if you understand what are the things that makes you sneeze all the time from hay fever, and you try and avoid it. These are the simple preventive methods you can do. It's not complete. It's not therapeutic. It's not a treatment. But these are the little things you can do to help alleviate the discomfort people get from hay fever. So now we'll come to treatment of hay fever. One thing to note is hay fever is allergic response. It's nobody's fault. It's not a transmitted disease. So for hay fever and similar allergens, there is no cure. There's no one tablet that just cures you, but you can control the symptoms. You can treat the symptoms. It's not necessarily preventable, but we've talked about the things you can do to prevent or minimize the severity of hay fever. And remember, if you have hay fever, you cannot transmit it to another person, so it's not contagious. Don't avoid somebody because he has hay fever. People might be sneezing, yes. They sneeze out. They are not passing any infectious material if it is hay fever. But remember that there are other causes of sneezing. If you have a virus or a bacterial infection, or you're coughing or you're sneezing, you can pass that to another person. But for hay fever, it is not contagious, it is not transmissible. So the person sneezes, yes, he's sneezing out stuff, but that does not mean that he's going to catch hay fever. But remember, I will always advise people, when you're sneezing, you sneeze into your elbow. Don't sneeze in your hand because it's not hygienic. You might be passing something more than just, mucus from hay fever. You could have an infection at the same time as hay fever. Now, avoid pollen and other things that cause hay fever. We've talked in details about this. So, avoidance. We know we've already talked about keeping your doors closed. If you've been outside, try and clean your clothes off of this pollen. If you have pets that go outside and come in, always wash them, vacuum clean, keep your environment clean. Now, if one has mild hay fever, you probably don't need any treatment, because if you're able to control the symptoms, simple preventive measures might be enough, and then when the season passes, then you'll be fine. But if hay fever is affecting you on a daily basis, the first thing we normally advise is to take antihistamine. Remember, I talked about histamine release in allergy. So there are medications that stop this histamine being released, or even if they are released, they minimize the effects on the body. So these are antihistamines. You can get a lot of them from across the counter in the shops. There are so many of them. There are ones you can get across the counter. There are ones you probably get from your doctor, which you cannot get across the counter. We cannot say one antihistamine is superior to the other, but what you know is that you might try one antihistamine, it doesn't work for you, you try another one. If it doesn't work for you, you can go to your doctor. The doctor can give you the prescription-only antihistamines, and people have found out that until you get the right one, once you get the right one, you can take it, and when the symptoms are gone, then you stop them, and they're not addictive. So I know some people who have symptoms around the year. For those people, you may need to see your doctor to make sure there's nothing else going on. It's possible to have what we call the chronic type of hay fever, but also get checked so that nothing is being missed. Now, we've had people who have had hay fever and they've tried all tablets and it hasn't worked for them. There are a small percentage of people who might benefit from a steroid injection. For these people who have tried all the tablets, have tried all preventive measures, and nothing has worked, you can speak to your doctor. There's an injection you can have that protects you or treats you for many months. But speak to your doctor about that. There are specialized treatments as well, for hay fever, which you don't just get from your doctor. You have to go to special centers, and these are immunotherapy. Remember, I'm talking about hay fever being an allergic response. So anything that reduces the body reaction to these allergens, which I call them allergens, like pollen, is a treatment of choice. So antihistamines do that, the steroids do that, and if they don't, the immunotherapy is actually a treatment where the person is exposed to very tiny amount of the pollen, over several months, and gradually the body starts accepting the pollen and stops seeing it as an allergen. So that is immunotherapy. It takes several months, but it has to be done over a long period of time and in a special center under supervision. So that is for immunotherapy. But one fact about hay fever, I'm sure you would like to know, is half of people suffering from hay fever actually improve over a few years. So over years, some people might have hay fever this time, in 5, 10 years or 15 years time, they stop having hay fever. And 1/5, 20% of people suffering from hay fever recover completely from that. So this is why this health program is important. It brings the day-to-day fact about some of the common health problems we have, which we have questions, but we can't get answers, and you might not get this answer from your doctor. So when you tune into Health Corner, we would like to answer your questions and actually treat these topics in simple language. Look at the number on the screen to contact me. I'm very happy to answer your questions. I have the phone, the number to text, and the email address. So I'll be very happy to answer your questions regarding this hay fever and any other topic you might have. So always tune in to Health Corner every Saturday by 4 p.m. for interesting and new health topics that answers many of your questions. And also remember to send me information, your questions, or on email you see on the screen or by text. I'm very happy to answer your questions.